I'm Paul Irwin, Dean of the School of Public Health at UAB, and I want to welcome you to this webinar focused on COVID-19's impact on food and shelter insecurity, a conversation between public health experts and community-based organization leaders. This is the third webinar of the COVID-19 webinar series sponsored by the UAB School of Public Health, with a focus on interdisciplinary conversations between experts. Our panel today includes Carrie Leland, Executive Director of Pathways, the oldest continuously operating agency in Birmingham dedicated to serving homeless women and their children. Our second panelist is Amanda Story, Executive Director of Jones Valley Teaching Farm, a collection of 7 teaching farms across Birmingham focused on food and farm-centered programs. The conversation will be moderated by Dr. Shantice Allen and Dr. Faye Fletcher, both from the UAB School of Public Health. Please note that this conversation is being recorded and will be available on the School of Public Health's YouTube channel later. Our moderators will facilitate the conversation with a set of questions, and you may submit your own questions through the comment feature on Facebook. Thank you for joining us, and I'll turn it over now to our moderators.
Thank you, Dean Irwin. Famous architect John Rohn once said, "Whatever good things we build end up building us." The COVID-19 pandemic has illuminated a bright light on 2 areas where there is much more building to be done. The disruptions triggered by COVID-19 have shown the fragility of people's access to essential goods and services. In housing and food systems, critical weaknesses, inequalities, and inequities have come to light. Individuals experiencing housing and food issues during this time are much more susceptible to the transmissibility, severity, and other features of this disease. The crisis has, however, offered a glimpse of communities coming together to plug gaps in food systems through feeding children, school children, distributing free meals to healthcare workers, and leveraging partnerships to support housing and homeless service providers. We acknowledge the importance of this conversation by spotlighting the need for food and shelter for every single person as a human basic essential right before, during, and following this unprecedented outbreak. I'll now turn the conversation over to my co-moderator, Dr. Faye Fletcher.
As described by Dean Irwin, the purpose of this webinar series is to center the most marginalized communities in the COVID-19 pandemic. So Carrie, we're happy to have you here today to talk about your work, Leading Pathways. Would you speak to COVID-19's impact on the homeless population?
The impact on the homeless population has been to the services that they rely on to make it through the crisis of being homeless. Most shelters have had to drastically alter programs to deal with this pandemic and to protect the health of the clients and staff. One of the biggest challenges Pathways has faced up to this point is there has not been a way to test asymptomatic people to then admit them into a congregate living situation like a shelter. This has presented a huge problem as we seek to admit new people into the shelter, and that's what we've been dealing with. We need to think of it this way. If someone who is not homeless becomes infected with COVID, they might take it home to their family, say a family of 4. But if someone who is homeless becomes infected with the COVID-19 virus and enters a congregate living situation like a shelter, that person could be taking the infection home to up to 70 people when you consider the other people who live in the shelter with them and the staff that provides direct care.
Thank you, Carrie, for those considerations as we learn more about vulnerable populations and what their lived experiences are like today. So in your role as Executive Director of Pathways, serving both women and children who experience homelessness, what are your daily operations like during this pandemic?
Our daily operations have been altered, as have the daily operations of many of my fellow homeless service providers in the city. Pathways has 2 residential shelter programs, and then we have a daytime emergency shelter. And this daytime emergency shelter is the oldest continuously operating program that Pathways has. It was the first thing that we did for homeless women and children in Birmingham. We have had to temporarily suspend the operations of our daytime emergency shelter that we call the Day Center. And the reason is because it serves up to 80 people a day, and that's a cross section of the homeless population. These are the homeless women and children who live on the street, as well as those who live in nearby emergency shelters and the people who live in our own shelters. For the first time in over 30 years, the Day Center is not operating at this moment. That was a hard decision to make. This decision had to be made because it was the right thing to do to prevent community spread, not only within our population that we serve who live at Pathways, but the street population and the population from other shelters who come to Pathways for daytime services. It was the best decision to prevent the spread of the virus. And I think it's possible that the Day Center could remain closed until the end of July or the data improves. And we will seek the advice of health professionals as we determine what to do. Also, I want to mention that our residential shelters, Stepping Stones and Safe Haven, where people live, those are only operating at about 70% capacity at this time to allow for social distancing. Which is hard in a shelter. And as I spoke before, we need to figure out how to test the homeless population as we bring them back into shelter. And filling our beds is something we want to do, but we need to figure out how to wisely do that, keeping the health of everybody in mind.
Thank you, Carrie. So along those lines, as it relates to the homeless population in Birmingham, would you describe some strategies for the safe reentry of the homeless population into shelters such as yours?
Yes, since about mid-March, I have been part of a group that has been talking healthcare professionals, the health department, the local continuum of care, One Roof, lots of homeless service providers. We have been talking regularly about what to do. We have been working with local leaders to establish a central temporary shelter that people can go to while they're awaiting entry into the shelter programs. So around the middle of next week, maybe the week after, people seeking entry in a shelter program will stay at this temporary location for 14 days and be tested for the virus. After a negative test result is confirmed, then that person can then enter one of the emergency shelters that they are seeking to get into. We are also working on plans of how to test our current shelter population and staff to ensure that there are not existing positives within our current sheltered population or our workforce. We have not been previously able to test those living in shelter who are asymptomatic. I want to point out that it's a tragedy to be homeless, but it's a greater tragedy to be homeless and have COVID-19. So homeless service providers are burdened with the task of not being healthcare professionals, but having to be very wise and very thoughtful about how we admit people into our programs, how not to become hotspots of spread. And we are relying on the data and not the orders that are coming down from the state or those recommendations, but we are looking at the data. I can speak for myself. I am driven by the data of the disease transmission in Jefferson County and around us when I make decisions.
Thank you for that information. And it's nice to know that there are these strategies in place and that the homeless population is being considered at this time with leaders such as yourself. So during the COVID-19 pandemic, as you mentioned, many states have issued shelter in place or stay-at-home orders to flatten the curve. Carrie, how did these orders translate to the homeless population?
One thing about these orders is they've come out and we've all been told to stay home and do our part and be safe at home. The key word there is home. That has really struck me, and particularly as I am right now in my own home where I am taking shelter when I'm not at work. I have a home to be in, and I am very grateful for that. And I think many of us have started to realize the importance of having a home during this time. But let's consider that the homeless do not have a home. And so because the homeless do not have a home, the approach has been how to keep them as safe as possible where they are. be that in an emergency shelter that they were already in when the pandemic came, or be those that live outside on the street, our street homeless populations. At Pathways, I can tell you that our residents have been observing a total quarantine since April. This means not freely coming or going, no visitors, group meetings have been suspended, things like that. I want to recognize that I am not homeless, that I go into work and then I come back to my home. And so I can tell you that it has been extremely difficult, and that decision was not made lightly. It is a burden for sure for us to have to restrict the activities of our people and be on total quarantine and to keep that many people, women and children who are bored, quarantined. But it is the best thing that we can do right now to prevent spread and prevent our shelter from becoming an outbreak hotspot, which is something that I'm sure no health professional wants. And so it's important to remember, while we are all going through this pandemic together, none of us are experiencing this crisis in the same way. And it has been extremely difficult for those who live in congregate situations to go through this. They experience it in a way that those of us who have homes are not experiencing it.
Thank you, Carrie, for that insight. So we began this conversation focused on COVID-19's impact on the homeless population. Many are also concerned that COVID-19 will potentially increase homelessness. So in your expert opinion, what are some solutions needed to prevent and end homelessness during this pandemic and beyond?
This is a very important topic because homelessness was here before COVID and it will be with us after COVID. What I think is I'm anticipating an increase in the number of people who become homeless due to the economic fallout of this pandemic. People who don't have safety nets and will not be able to pay their rent or mortgages in the next few months. I think we will start seeing people become homeless who were living a paycheck or two away from homelessness before this, particularly when the moratorium on evictions are lifted. Navigating COVID-19 is uncharted territory for our nation. But I want to point out something here. We do have experience as a country with recession and depression. The federal government has already set aside millions of dollars for Jefferson County to help battle the effects of the recession that could be coming. I believe expediting the utilization of these funds can help people affected by COVID who are at risk for losing their housing, rather than get them into shelter, to use these funds to get them back into housing after they lose their homes as quickly as possible, or keep them in their homes. And I work in homeless services. This is after someone has become homeless. But I do not mind advocating for the great need to prevent homelessness. It is much cheaper financially and emotionally to prevent homelessness rather than to rehouse someone after they have been homeless. I want to point out also that this brings to mind things that we have been dealing with as a nation, as a city, as a county before the pandemic. The pandemic has just brought these things into the conversation when they may have just been on the back burner before. Our nation has a deplorable lack of housing for working class people. Alabama alone has a measured need of more than 90,000 units of housing for people that is affordable, truly affordable, for people who work minimum wage jobs, people who are on fixed low incomes. This is a time, as we move forward, as we make our way out of this economic recession and this crisis, this is a time to institute policies that assure that we respond to this need of truly affordable housing for working class people, and that we address this lack of units that Alabama has. As we move through the economic fallout caused by this pandemic, I do believe that that need needs to be forefront and center as we talk about solutions going on. Because if we don't address this need, more families will be forced into homelessness, and there will be a greater demand for services like Pathways. We will have to serve more people. And that's the balance of nonprofit, is serving those who are needing your services and how to do that. But I want to end with this. I want to talk about the collective suffering that we've all gone through during this pandemic. And I want you to think about your situation right now as a non-homeless person, for those who are watching who are not experiencing homelessness. If you are worried about an uncertain future, if you're worried about poverty if you're worried about financial problems, food insecurity, lack of health care, how do you get tested? How do you access testing? If you're worried about childcare and when that opens back up and how you're going to go to work, if you're worried that your friends and family will be able to help you, then you are experiencing what life is like for those who live daily prior to this pandemic on paychecks that didn't offer a living wage, for people who were born into systemic poverty, for people who were already homeless and live without access to the essentials that we all need. The anxiety, the feeling of being overwhelmed and running on survival mode that we all are in right now, it is exhausting. And so what I want from this is for us not to forget this walk in the shoes that we've had of what the marginalized were experiencing long before this crisis. Because most of us who are not homeless and who are not in these categories I've mentioned, we are in a crisis that we will rebound from. We are just waiting on a return to our new normal. For others, this is the way it was, and this is the way it will remain. And all of society has now been promoted from sympathetic to empathetic. And so what I want to tell the viewers and the listeners is that you are now qualified to go forth and to encourage others and to solve social problems. If you're concerned for your neighbor now, take that concern with you because you've been qualified by what you've seen and what you've experienced. And my hope is long after this COVID crisis is over, society will be kinder to those whose crisis will never pass. And they will partner with homeless service providers like Pathways to help us to continue to address the needs of our neighbors who do without on a regular basis.
Thank you, Carrie, for being here with us today, and thank you for shining light on this important issue. Finally, thank you for your service, and thank you for serving as an essential worker during this pandemic. I'll turn over the next portion of the conversation to Dr. Shantice Allen.
Thank you, Dr. Fletcher, and thank you, Carrie, for those really powerful statements around how we all are a part of the solution to individuals having safe and secure housing opportunities. And coupled with that, we're going to turn the conversation to a complement with housing, which is food. And so Amanda Story, who is the executive director with Jones Valley Teaching Farm, is with us. And Amanda, my first question to you really centers around kind of a pre-COVID and now COVID situation. So we know that the physical aspects of an open farm market may actually make them safer than grocery stores, giving their adaptability to shifting during public health context. Can you speak to how Jones Valley Teaching Farm sites have adapted to the shifting public health and economic realities of COVID-19, in terms of food access, and how are you working? How is your actual organization now working within the midst of this pandemic?
Sure, I'm happy to talk about that. We are, as everyone else, figuring it out as we go, quite frankly. And I think it's important to say that because we are just experiencing a brand new way of thinking about our work, every single one of us. So normally, pre-COVID, that's what I always say, pre-COVID, we would be running full programming right now on school sites. So 6 of our sites, we have 7 total teaching farms, and 6 of our teaching farms are actually on Birmingham City School campuses. And a lot of folks don't know that about us. A lot of folks just know us from the downtown farm, which is our largest farm and where we started our work. So we have had to adjust. When the schools started closing, we lost all the students because they were no longer participating in programming during the day where we teach. We use the teaching farm as a teaching tool all day long. And we also have after-school programming that's free to students and their parents that also provide a place for students to go until their parents can pick them up. So we're always used to having students there, and we are used to running those farms in a very open way with the school system. When the schools closed, we had to make a very specific decision, and we had to stop. We stopped for a week, and we looked at national best practices. We looked all over on ways that we in other cities that were impacted greatly, how they were still continuing to grow food. Because at the end of the day, we've always used food as our foundation. Growing fresh food is our foundation for learning and growing for young people specifically, right? So we knew we needed to turn these teaching farms into production spaces. We may not be able to teach all day long. We may not be able to have after school programming, but what we can do is grow as much food as we possibly can and get that into the hands of our community members. We already knew that the impact of hunger in Alabama and Birmingham, it was huge before COVID hit. And the first thing I thought of, having worked in policy around food systems and also working at the food bank prior to my role at Jones Valley, it kept me up. I just did not know how we were going to meet the needs when we already couldn't. 1 in 4 children in Alabama are hungry. This is before COVID. 1 in 6 people in Alabama are hungry. 76,000 children in Birmingham are food insecure. So when you're looking at those numbers, that's immediately what I started thinking of. And so for me, what we knew is let's help fill the gap in any way that we can. Our farms are not huge production farms, but there's something, and they can add to the need at all of the pantries or the food banks, small food banks that are delivering food right now out to our communities.
Wow. That, just listening to some of those statistics that you just gave, Amanda, are just, so startling, and really makes you think about what, where the situation that people are in even before this pandemic occurred. And so we know that the COVID-19 crisis has left a number of children, too many really, children hungry. As you mentioned, this 1 in 4. Many of your farm sites are associated with elementary, middle, and high schools. So could you just share with our listeners the types of issues that you and your staff have noted with children and food stability at your various school sites? And obviously children are not there, but would like to hear some of the things that you all are experiencing or observing as you turn to more of a production facility versus the educational piece. And then also talk about why the value of fresh food is important. And what issues are you all seeing with food insecurity? So, I know that's a number of questions, but would love to hear some response from you on that.
Absolutely. So the first thing I would say is, and I think it's important to talk about this, we took that week long to look at best practices because we had to make sure that how we were growing and harvesting food was as safe as possible right now. We're used to having volunteers on our farm in spring and summer when we need them the most to actually help us with this really peak time where produce is coming in. So we have 24 folks that work full-time at Jones Valley Teaching Farm. And no matter what our role was, pre-COVID, we are all now farmers because it's taking all of our hands to actually make this work, right? So the way that we've identified that, we already knew when we work with Birmingham City Schools, all of the children that go to Birmingham City Schools at this point as community eligibility, it means that if you have a high level of poverty within a school system, then free and reduced meals are available across the district. That is so. So we already know that we were dealing with food insecurity within all of our schools, and of course we see that in the agencies that we partner with, especially today when we've reached out and said, what are you seeing that are directly around our sites? It was important for us to make sure that we connected with those community-based organizations that were working directly in the communities that we actually have farms, so that the students and the families that are used to our produce or that have gone through our program would have access to some of the same produce that we're growing, since our markets are kind of closed right now. Normally we would be selling our produce. Kids actually run their own farmers markets at all of our schools, and so they're able to sell directly to their community. And we also would be selling at Pepper Place Market. But we have made the decision for as long as we possibly can, instead of selling our food, we will just be donating from here on out. So we like the fact that linking up with local agencies that already have that in mind, that they're able to give to the families that we would normally be seeing, or the students we would normally be seeing on our sites. So those are the ways that we have tried to link up across so many different avenues and to fill the gap. What we're hearing from the agencies around our schools is that food is really hard to come by right now. And so when we talk about fresh food, there's a couple of things I would point out. So we were already, like I said, pantries were already having waiting lists. This is before COVID hit. So there were already waiting lists for families to receive food. Now you've got an additional amount of families that are needing food, and that shifts every day as the unemployment rate rises and as new folks are looking for those outlets for food. And so what's happening is that the food that was already in short supply is even more so now. So food banks, when we have been talking to the local food bank agencies or smaller faith-based organizations that do food deliveries, you name it, there are so many in this community at almost in every single neighborhood, I would say, that are trying to fill that gap. We just said, why don't we take our fresh food and combine it, since you're already short from what you're trying to order? Let us try to fill that gap with fresh food. And fresh food is important because we know that that is sometimes the most expensive to buy if you are needing fresh food. We also know that, if you don't have access to appliances, or if you are living in or below poverty, just think about what it takes to also cook food. And so having fresh food and ways to assemble fresh food. We had actually folks reach out to us and said, we don't have the appliances it takes to cook right now, but we could give a huge amount for salad and nutrition that could come through that. So how we're managing those two things, I think, are important in the way that we see food and the importance of that as well. So that's what we've been doing, or trying to do at least.
That's fantastic. Thinking about this pandemic as this evolving, kind of ever-moving target, and what you just mentioned about, again, shifting and pivoting and talking with other community organizations about how you all can help fill those gaps. We also know that this pandemic has played a major role in reshaping our interactions with food and the food that we're even able to access. Can you speak to how these disruptions have affected your organization's experience with growing food at your farm sites, and what the impact has been on Jones Valley Teaching Farm?
Sure. So there's a couple of impacts. One thing is that growing food, harvesting food, washing it, packing it, getting it ready for distribution, it's incredibly hard to do while social distancing. But we are trying our very best to do that. When we hit 85 degrees last week, it was very hard to wear a mask all day long as you are farming. And that's what's happening on our sites all day long as we're farming. So those are just some impacts that we're seeing at an organizational level that's different and that we're having to adjust to. But all of our protocols and safety protocols are adhered to. And so we have small groups. Our 24 members of our organization, like I just said, are spread across 7 different sites. And so we can keep on our smaller school sites the numbers very low so that there's no crossing of members. And then for our larger sites that need a little bit more hands-on help, we have even smaller groups, kind of a cluster of 5 or 6, to make sure we're staying in those protocols. Dr. Wilson, our health officer, has been incredibly helpful in that. So we've been sending him our protocols to making sure that what we're doing is safe. And so that's utmost important. So that has been a shift organizationally. A positive impact that's happened, because I think it's important to focus on some of the positive impacts as well, is that normally our students that work with us would be on our sites working and growing food. And what we're finding is that some of our students are actually growing food at their homes now. And so that has been a huge piece of this, because when we talk about fresh food and we have to be real about what it means to grow your own food and why it is so important for the work that we do, is growing your own food being the foundation for learning and growing, right? Because if young people begin to gain the skills of being able to grow your own food in your own yard or your own neighborhood or in your own apartment complex with containers or whatever that needs to look like, how you share that and give that back to your community is incredibly important. And we know from the impact that the students have already said, the reason why they do this is to give back to their community. And so we're learning as an organization where we may have been so focused on the educational outcomes, which is true, we still will be. What we're finding is at that foundational piece of our work it continues to be what students have always told us, and that's giving back to themselves, their own community, and being able to be a resource as well. So when you combine both of those things and you kind of see them come together at a time that feels really hard and dark and challenging, because I think we have to say that out loud, and how food can play a different role if we have the means of production, if we own our own land, and if, especially in communities of color, especially when that has not been allowed, when there have been laws against that, and years and years and years of turmoil and trauma around growing food. So how do we shift that? And it's been nice to see young people take back the control of that and be able to take it under their own ownership and grow their own food. So I just want to point that out.
Love that. Thank you, Amanda. You know, thinking about power shifting and people being empowered to grow their own food, even after this is over with, we certainly want that to continue, knowing that Birmingham isn't a food desert, and we have food shortages anyway. Just the opportunity for people to really begin to interface and interact with food in a very meaningful way, pre-COVID and post, because we are going to get through this, is really just, it's a powerful message, I think, to bring. And so we appreciate that. What would you want families near your farm sites to know about Jones Valley Teaching Farm? And how can the public support your organization or donate food safely with you guys?
Sure. So I would say what I would want families around us and all the students that we miss terribly to know is that we hope to get back as soon as possible, and that all the seedlings that were planted are still growing, and that we are maintaining the spirit of the idea of growing food. We're maintaining that spirit. There's a hope attached to growing food. When you start a seed and you watch it grow, there's some really powerful things that happen in that process. So we want them to know that that is still happening in all of those sites, and it's still a beautiful thing to see. It's also getting into the hands that we hope need it the most. And so whether it's the flowers that we would normally be selling at Pepper Place on Saturdays, we always do these really beautiful bouquets. We assemble them on Fridays. Yesterday, we did 60 bouquets, and they were all going with food distribution boxes to 60 families today, and just in time for Mother's Day. If it's delivering flowers to nurses' stations, if it is delivering 50 pounds of collards to Bales Catering in Woodlawn, if it is getting produce in the hands of pantries that need it, those are the things that we hope that we can continue to contribute to, and I want them to see that. Helping us right now, I wish we could say, please come to our farms and help us, right? And volunteer as we would normally do, but we can't. And so I would say that the only way that you can really support us right now is lifting up these messages so that we can definitely get the word out that this produce is getting into our communities, letting folks know the hope and joy and the pieces of light that we're hoping to help share during this time. And also, of course, I'm an executive director of a nonprofit, so you can always donate to Jones Valley Teaching Farm. That's kind of how it works, right? But that being said, I just want to point out one other thing, if I just have 2 seconds, Dr. Allen, which is to say that we are just but one community doing this work. A community organization. We're a nonprofit. We are very much attached to our public school system. That is our structure. But there are incredible organizations throughout Birmingham and the state of Alabama and all over the country that are working at a neighborhood-based, community-based programs and giving food to communities all day long. And this has happened in communities of color. It happens across our entire city in all of these different pockets and neighborhoods. And so I just want to lift that up, because we hope to represent a lot of what's happening that's so great, but there's so much more, and just finding those places and supporting them as well is very important to us.
Thanks, Amanda. That's just fantastic. We are actually, Fox 6 is live streaming our conversation as well. So we've got a few questions that have come in from audience participation. So actually, Carrie, I've got a quick question for you. And I also have something for you, Amanda, but I'm gonna toss to Carrie for just a second here. And thank you again for all of that great information about what's happening with Jones Valley Teaching Farms. But Carrie, there's a question around, how do Governor Ivey's new orders that are effective on Monday impact your organization?
I understand the governor's orders. She's thinking about the economy. There are people who are ready to get back to life, going out and going to work, and small business owners who feel like there's a need to get their business back open. But as far as me, the executive director of a homeless shelter, who is responsible for the health of the employees who work there and the many people who live there and rely on our services, I have an obligation to look at what's best overall, and considering the data and listening to the health experts and realizing that the trends are still going up right now as far as those who are positive and dying of this disease and community transmission. And we are not where we need to be with testing. And so her orders for pathways, I can't speak for other homeless service providers, but that is not going to alter what we are doing right now. We're going to continue to do what we are doing because I have to rely on what the data is saying and what the health experts are advising. And so it's in the best interest of the women and children that we serve, because like I said earlier, being homeless is a tragedy, but being homeless and having COVID-19 is a greater tragedy. And so I have a responsibility to appreciate what the governor says, but then make my decisions based on the data and the opinions of health experts. And we're going to continue to do that.
Thank you, Carrie. Yeah, definitely making decisions around evidence, around good information, quality information, good data is important. So we definitely appreciate you thinking and really driving your decision making around that. Amanda, I wanted to ask you a question around the types of foods that Jones Valley Teaching Farm sites are growing in response to COVID-19. What actually is coming out of the farms now?
Sure. So right now we've got, I always call us the Jones Valley Collard Farm because we grow collards year round. It's just something that we're known for. So we have a lot of collards that are coming out, which is very helpful because they go a long way. And a lot of folks don't know that you don't have to just cook them. You can actually thinly cut them and put them in fresh salads as well. So there's lots of really great uses. Kale, lots of lettuces that are coming out, carrots, turnips. We also have, I think, radishes right now. We have small amount of strawberries. So when the strawberries come in, we get so excited. But what's growing now, which is so exciting, is our tomatoes. So now we're getting into summer crops now. So we're moving into those bumper crops that are going to be incredibly important to food distribution. And so two of the things that we're doing is we're growing squash and cucumber seedlings right now that we will be distributing to other community gardeners, urban farmers that we've been partnering with across the city who are also doing all of this in their neighborhoods. How we can grow seedlings and share is really important to us. So you're talking about tomatoes, peppers, squash, cucumbers, watermelons, those things that come in bulk and that can go a long way. And so that's something we're very excited about. We'll start that process in a couple of weeks of getting seedlings out to families so you can grow those yourself. But those are a lot of the crops that are coming out now, and carrots too.
Thank you, Amanda. So Carrie, there are a lot of people who are wondering how they can support the organization during this time. Can you provide some insight on that for those who want to contribute? We talked about collective help at this time, so can you speak to that?
Yes. So for Pathways, we have a website. It's pathwayshome.org, and we have a wish list there. And we also have a link to our Amazon wish list. And so while we can't have people necessarily come to the shelter and interact with us dropping things off, and we can't have volunteers at this time because it's just not safe for those that we serve. But I would encourage people to consider buying us some washing powder, some cleaning products. We have to sanitize on a much larger scale than you would at home. We are doing 90 loads of laundry, sometimes just within a 2-week period, because we have to wash everything and often. If you see some masks, send those to us. I know there's a few companies in Birmingham, and you can have those shipped to us. And that's a very safe way for not only Pathways, but other shelters or organizations that can't have volunteers, or it's not really safe for you to come in and bring things at this time. Those are great ways that you can continue to support the work of those in need, is order and have it shipped. This is a really great time for that and a safe way to do it.
Thank you, Carrie. We appreciate that.
And I would say the same thing for Jones Valley. It's we had to do an all call for more gloves. We're going through gloves like we've never before, because we're having to change them out, and the way that we harvest our food has very specific protocols around that and how we touch things. And so gloves and masks, and as well as cleaning materials, we're going through so many of them. But until we can have volunteers on site, that's a great way to help us, and to just drop them off to our downtown farm or ship them as well. So our website is jvtf.org, and has our address and all of that wonderful information as well. So we would welcome the exact same thing.
Fantastic. Any particular types of gloves that you guys are in need of? Want to be specific so people know what to do.
Ours would be the latex gloves that you would see in a doctor's office,
Okay.
Or another setting like that.
Same with us, or food service gloves can also be helpful for us. So hopefully that answers it.
Yes, it does. It does. Amanda, I'm gonna toss a question to you. Then I've got one for you, Carrie, to come back to. And actually, my question that I'm gonna ask Carrie could go to both. But Amanda, ahead of the summer harvest, do you have any concerns of how COVID-19 might affect volunteer capacity at the various farm sites?
So right now, I agree with Carrie. What we're looking at is data. And for us, we are not making any changes to our volunteer opportunities today at this point. And that won't even probably look at that until June, and to even understand if we're going to move in a different direction, right? So for us, we're sticking with our main core staff, which is 24 people. So what I'm most concerned about is, as the temperatures start to rise, our folks farming all day long and cloth masks can be really difficult. And so what we're trying to figure out is that balance, or finding masks that actually have breathability, that is still safe for food. Maybe it's used in commercial kitchens. I don't know. We're still looking for that information. So anyone that knows if that could be helpful, that's something that we're mainly concerned about, is that heat, and how it may affect us if we're having to do all of these extra precautions.
Got it. So this is a question actually for both of you. Thinking about the whole notion of a system, a food system, a housing system. Do you all have thoughts on some policy solutions, thinking kind of big and broad, of how we can, as Carrie mentioned earlier, we're in the business of prevention. How do we begin to really think about long-term systemic policy solutions to food access, the issues and around homelessness? And Carrie, I'll let you answer first.
Okay, I would like to address the prevention of homelessness. One thing that I think we really need to focus on is, during a time like this, we want to do something to respond to the pandemic. But let's not panic and build resources that we're not going to necessarily utilize after this is over in a permanent way. I would love for us to start thinking outside the box and start thinking creatively, and what an opportunity to do so. We need to collaborate to utilize what already exists when we talk about this lack of housing, of affordable housing that we have in Alabama. And so an example of that is, if we had a properly planned strategy. What if we looked at empty schools? What if we looked at shuttered offices? Could these things be used as emergency housing? Could we really take people off the streets? Let's look at alternative planning and do it intense planning for that. And one thing that I want to mention is, can we all just agree that no one should have to sleep outside? Can we all just agree that it is terrible to be homeless and have nowhere to be? And we're all going to have dwellings of different value and different comfort. But what if right now, as a society, as a city, as a county, as a state, we decided that it was inhumane for someone to sleep outside in one of the richest countries in the world? What if we decided that it was deplorable, use that word again, and inhumane for people to not have basic access to health care? What if we decided that in order to lift people out of poverty and sustain them in a job, that childcare needs to be readily available and free if needed? We would see tremendous economic gains, and we wouldn't be chasing a problem if we would decide what needs to be acceptable in this city and in this nation for human beings, for citizens of our country, regardless of what they struggle with. But there's just some baseline things that people need, who are our neighbors. And that's what I want to point out. They're our neighbors. And so what if we looked at these shuttered office buildings? What if we looked at these schools? What if we said, hey, we could creatively invest and we could create some housing? We could start meeting the demand for affordable housing for people who live paycheck to paycheck, for people who live on fixed low monthly incomes. What if we talked about what to do for those who don't have any incomes? What if instead of chasing a problem, we started talking about solutions? And so that's a conversation that I am really interested in being a part of. And I think there are people that are far smarter and more important than me who can solve these issues.
Now, Carrie, you are incredibly important to this conversation around policy solutions. Amanda, I want to ask if you could respond to that same question, thinking about food systems and how do we begin to systemically, long-term, think about policy solutions to food insecurity?
It's very similar to what Carrie was saying, because when we talk about shelter and food, it's human rights. It's what we are fighting for on so many different levels. And so what allows for that to happen? We're looking at poverty, right? Employment of people at living wages that would allow for us to have more flexibility in what we can buy and the choices that we have to buy, right? So that's number one. I think also being innovative and looking at all of the resources that are currently underutilized in our communities, joining forces in order to make those a distribution as well. Just what Carrie was saying, it's very similar. How can we increase our capacity to get that food out the door? And then what are we funding at a national level, at a federal level, at a state level? Are we funding grassroots organizations that are truly in communities doing this incredible work? Are we funding, how are we subsidizing food? How are we, which farmers are we giving funding to? And how are we lifting them up as well? So farming in general, and as you can look across the nation in the news right now, is suffering. All of our farmers are suffering. And so how do we at a federal level support them as well? So it's incredibly complex and complicated. You have to deal with transportation. If you want to get food, you have to have transportation. If we have, food that's available at schools right now for students and their families, if you can't get to that school, that is not an option for you. So there are things that are in place that are happening, but it doesn't mean that families can access them. And so if you want to talk food, you have to talk transportation. You have to talk shelter. You have to talk of, all of those pieces. They're all connected. And then what is the crux of that? And that is living wages and employment of people and their families. So
thank you, Amanda. Thank you for those reflections. So we're talking about these intersecting inequities. So I'd like your feedback. We have a question coming in from the audience. For those who have an interest in being a food supply in food deserts, what are your recommendations for that?
I would ask the question because there's many different ways and avenues to do that. So if you're a supplier, I don't know if you mean a fresh food. And so one thing I would say is grow your own food. What if everyone had a garden? What if everyone had a garden? Those are some questions that we should be asking ourselves right now. in terms of solutions. So that's one piece, is how do we grow our own food at a community level. And if it's for the food banks and how to get food safely, there are protocols that you can just look online and see how they're accepting food. Our community food bank of Central Alabama is leading the charge on a lot of that, as well as lots of food pantries. So because those are based to help with that piece, if food deserts are an issue, which they are, then look online or find those resources and figure out how they're receiving food and what they need the most of. That when, sometimes food banks will say, I need peanut butter, and if that is the protein choice and the easiest thing to do. So they have lists that you can follow. And then if you are a grocer, I can't answer that question, but there's lots of folks at the city of Birmingham that could around the regulations of what that means. So there's so many different things. But I would say the biggest question is, how do we collaborate together? I'll just say quickly, Woodlawn Foundation has actually convened about 15 to 20 of us a week on a phone call that's all serving on this side of town. So we're able to pick up the phone and we're reporting on what we're seeing. Just the ability to communicate with one another, which is increased from what we were doing even pre-COVID. We weren't communicating the way that we are now. So this is an opportunity, I think, for all of us to look at one another and say, what do you need? What have you heard is a need in your own community, and filling those gaps, even at a very grassroots level.
Thank you, Amanda. And I'll toss this next question to Carrie. Carrie, can you talk a little bit about your childcare program with Pathways? Folks are interested in learning more.
Yes. So before COVID started, we had spent about 2 years planning to open Birmingham's first child care center exclusively for homeless children that would be of no cost to the family for children ages birth to 5. So much planning. We received some funding for that. We did some space reallocation in our building, and I tell you, I've never been more excited about anything. Over 20 years of doing this, and opening the Child Care Center on April 1 was going to be the proudest moment of my entire career, to bring free childcare immediately available to homeless children in the city. Many times they are waiting for their spot in a subsidized childcare, and sometimes they fall through the cracks and they don't make it. And we know that less than 3% of homeless children are able to access high quality childcare and early learning opportunities. But COVID happened, and Pathways Early Learning Center did not get to open, and that is now delayed until we are on the backside of this crisis for the safety of those children that we will serve. But here's what I want to talk about. That was a vision: free childcare, immediately available, high quality early learning opportunities for homeless children who do not readily access those, being offered at the level where the family receives services. It sounds ambitious, and it is. But what I can tell you is I'm more inspired now to do it than I was before, because the entire nation has realized that without childcare, we cannot go to work and make a choice between providing for our family and making sure that we have safe provision for our children while we do so. It is beneficial for children to be in a high quality learning environment early in life so that they are able to be equipped with what they will need. And so while that is delayed by COVID, and that's been very sad, I think that we are going to start seeing national conversations around the importance of childcare. I would love to see childcare be a right. I would love for us not to say this child is in need of high quality childcare and early learning opportunities based on what the adult in their life is doing, but just that children need high quality learning opportunities to have the best start in life. All children deserve a safe place to be during the day, and all parents deserve to know that their children are being well cared for while they are trying to support the family. And so as we start making our way back economically, and I believe that there's some childcare centers who are small businesses who had slim revenue margins who may not be able to reopen after this pandemic. And so while Pathways will be thinking creatively about how we go forward, I want to do two things. I want to encourage you to continue to reach out to Pathways, partner with us, help us make this child care center a reality. It doesn't need to become something that falls by the wayside because of COVID, because it's going to be needed now more than ever as the homeless population could potentially increase. But I also want people to think about child care centers and just how important those are, and how important it is when you talk about people going back to work and people supporting their families. And sometimes society loves to get into the debate of what people should be doing, because we forget that equity is not the same. All of us don't arrive at opportunities with the same ability to access those opportunities. So when we start talking about how to get back to work and how people are going to crawl out of this, I want us to think about how important it is to support the notion that childcare is a part of how you get back to that and how you bring your family out of an economic crisis.
Thank you both for your commitment to social justice, both Carrie and Amanda. And we're nearing the end of our program, so we'll have Dean Irwin with some final remarks. Thank you both.
Thank you so much there. It's just wonderful to get your insights, Amanda and Carrie. Let me thank you once again for taking the time, and also thank you for your work and your colleagues, all of those who do this work. Thank you, Shantice Allen and Faye Fletcher, for moderating, and thank you, all of you who have participated in this conversation today. Let me remind you that this will be available on YouTube platforms for both UAB Medicine and the School of Public Health, with a few additional resources based on what we shared today. Again, thanks to all of you who joined us by Facebook Live, and let me wish everyone a good rest of the weekend and a joyful Mother's Day to all. Be well and stay safe. Thank you.